Good morning, everyone. Welcome back to Atlanta and Company. Allergy season is in full swing, and with Georgia being one of the worst states for pollen, you might need a helping hand to get you through it all. Joining us now from the Center for Allergy and Asthma of Georgia is board-certified allergist Dr. Eugene Hurwitz, and from the Georgia Drug Card, Vice President of Regional Relationship Manager Joy McAdams. Welcome to both of you. Thank you for being here.
It's good to be here, Christine.
Thank you.
Of course. Well, Joy, sit tight. I want to get to you in a minute, but first, Dr. Hurwitz, I want to start with you. Let's talk about the signs that someone actually has asthma. Let's go right to asthma. What are those signs and how do you treat it?
Asthma is signs it can include coughing, wheezing, shortness of breath, breathing difficulty, difficulty with exercise. In children, we sometimes see them unable to play sports or participate in normal activities and get short of breath. So the important thing to realize is that when someone has asthma, it can be completely treated and controlled. Avoidance of triggers is important, particularly this time of year.
Yeah.
If possible, use of medications, including preventive medications to prevent asthma symptoms. There are also the reliever medications that treat the symptoms when someone is having a severe asthma attack, as well as allergy shots, which are very effective for patients with underlying allergies.
And let's talk about allergies, how you test for them. I know when I was little, I just remember I was afraid of shots and needles, but we did a little test, you know, I think it was on my back or my arm or something, and I tested for several different types of allergens out there. Is that kind of still the protocol? How does it work?
It's still the protocol. There are, of course, blood tests, but skin test is what we do in our practice. It's the gold standard. It's a very easy test to do. It's very children-friendly in our practice.
It really was.
We use small plastic devices on the back to determine what someone's allergic to. And in fact, allergy shots are really not shots in and of themselves like someone thinks of normally. They're tiny little needles. We have 4-year-old children who come in and get their shots and don't even cry or complain at all. They get very used to it.
Right. And then the most important thing is you realize what they actually are allergic to, and then you can go about treating it.
Right.
Right.
The use of allergy shots is highly effective at treating allergies. It reduces symptoms by 80 or 90% for those who are suffering enough, whose allergies aren't controlled by medications, who are having recurrent sinus infections and asthma. Allergy shots are highly effective.
And how frequently do you have to get those done?
Initially, it's once or twice a week for the first few months. After that, it becomes easy to do once a month.
Good.
There are also allergy drops available for those who don't want to come in and get allergy shots.
Fantastic. Lots of different options. And tell us more about your practice.
We are the Center for Allergy and Asthma of Georgia. We have 8 locations, the newest one being our Kennesaw Acworth location. We care for children and adults. We have about 50% children, 50% adults. A large percentage of our patients come in without a referral. They come in on their own because they know they or their children are suffering from allergies and want to get relief.
Right away, right. And flash up the locations if you would, guys. I know we mentioned 8 locations. We want to make sure that everyone knows that there's a location close to them and to reach out and pick up the phone now or go online to learn more. And there they are right there up on the screen. And talk about what are the challenges when it comes to prescribing treatment.
Cost is always an issue for us. So we're always looking for ways to help our patients to reduce the cost, particularly of medications, which have become so expensive.
And Joy, let's turn to you now. Tell me all about this Georgia Drug Card. What is it? Who's eligible? Give us more information.
And just like Dr. Hurwitz mentioned, that's where the Georgia Drug Card comes into play. The Georgia Drug Card is a statewide assistance prescription program, and it was launched in conjunction with the Medical Association of Georgia, and it was designed to help lower the out-of-pocket costs of medications for people that struggle. And they may be struggling because they have a high deductible plan, or perhaps they have a prescription not covered by their insurance, or maybe they just don't have insurance coverage.
But you can still get this card, still be eligible. That's fantastic. How do I go about then acquiring the card? What do I need to do? Certain restrictions or regulations?
No, it's really quite simple. The Georgia Drug Card, you may be able to pick it up at your doctor's office, like Dr. Hurwitz has them in his lobby. If your doctor has it out, you can pick it up there. You can also go to the GeorgiaDrugCard.com, and there you'll be able to print a hard card. You'll be able to take it to the pharmacy that way. You can look up medication pricing. You can do a pharmacy locator, see them in your area.
Wonderful.
You can also use your smartphone and pull it up that way. Instantly, a hard card appears.
That's great.
And then you can take it that way. And then we also have our preferred pharmacy, which is CVS. And this is really great because even if you don't have a card, you can go into a CVS and the pharmacy knows exactly how to process it to access your savings.
That's awesome.
Yeah, so it's a really neat way to use your program.
Absolutely. And there's so many other ways, these discount cards we see out. What really sets the Georgia Drug Card apart from the rest?
Well, Christine, that's a really good question because, like, you're right, there are a lot of programs out there.
Confusing, right?
Exactly. One thing about the Georgia Drug Card is it is completely confidential. There is no patient information gathered. We're completely HIPAA compliant. There's no registration or enrollment fees. The card never expires. We also work closely with the Medical Association of Georgia to help get the card into the hands of patients who need help. And then, as mentioned previously, we have our preferred pharmacy, which is CVS. You can walk into any CVS and ask them to process your medication using the Georgia Drug Card, and they'll be more than willing to help you. We've also added a Aetna dental plan, and this is a program that helps you with your high costly things like fillings or perhaps oral exams, things of that nature that are usually quite costly. The program will help you, and you can go to the website to get that program. And then last but not least, we partner with Children's Miracle Network to help kids.
That's great.
And that's awesome because every time the program's used, a small donation goes to Children's Miracle Network.
Phenomenal. Such great information. And make sure everyone knows, once again, who qualifies.
Everybody qualifies. So even if you have insurance, we need to lower your out-of-pocket costs.
Yes.
So if you have a high deductible, you have a prescription not covered, you can go to the Georgia Drug Card and use it. And we're accepted at most major chains as well.
Fantastic. Thank you so much. Doctor, thank you for being here. Joy, thank you. Great information that a lot of us probably were not even aware that we have access to. So wonderful. Thank you so much. If you would like to learn more about the Center for Allergy and Asthma of Georgia, please log on to caageorgia.com or call 404-994-3574. And for more information on the Georgia Drug Card, simply log on to georgiadrugcard.com. And this segment was paid for by the Center for Allergy and Asthma of Georgia and the Georgia Drug Card.